General connective tissue. It is important to realize from the onset that the connective tissues are classified according to the type and arrangement of the extracellular materials, rather than features of the cellular components, as is true of epithelium. General connective tissues are classified as loose or dense according to whether the extracellular materials are loosely or tightly packed. Loose connective tissue can be distinguished further on the basis of special constituents such as fatty tissue or a concentration of a specific extracellular fiber. Dense connective tissue can further be subdivided according to whether the extracellular fibers are randomly distributed, as in dense irregular connective tissue, or orderly arranged, as in dense regular connective tissue. Learning objectives for connective tissue fibers. 1. Be able to identify and distinguish the 3 connective tissue fiber types. And 2. Be able to classify general connective tissues according to the arrangement of their extracellular fibers. The preparation illustrated in the field of view is an areolar spread preparation. This is not a section of material, but rather a whole mount preparation, such as a piece of mesentery or a thin spread of areolar connective tissue placed on a slide and then cover slipped. No sectioning has been done. This particular preparation has been stained with a variety of dyes to demonstrate 2 of the extracellular fibers. Collagen, as indicated by the arrow, is perhaps one of the more common of the extracellular fibers seen in all routine preparations, or at least most of them, of organs, and as a non-branched, long fiber of high tensile strength. In this particular preparation, it's staining a light orange. Another large collagen fiber is shown here. This particular preparation has been stained specifically to demonstrate another of the connective tissue fibers, an elastic fiber, which stains a dark black and wiggles through the field. Another is shown here, of fairly large diameter, and another courses across the field in this direction, and another one here. Very fine, thin, homogeneous, smooth appearing fibers, and as compared to the sort of broad, more coarse arrangement of the collagen fibers. Look at these at increased magnification. At increased magnification, several additional features can be made out, namely the collagen fibers. This is a fairly broad collagen fibers crossing the field. Another collagen fiber that is slightly narrower in overall diameter, and yet a smaller one, and yet a smaller one. So collagen fibers can assume a variety of sizes, as do the elastic fibers, which in this particular preparation have been stained selectively to be demonstrated. They are not seen in routine preparations usually, or are not obvious at least. Sort of a homogeneous black staining fiber is demonstrated here. Another course is here. And like the collagen fibers, they will show a variety of diameters, some of these being quite small. The majority of nuclei seen in the background are those of fibroblast nuclei, which lie on these fibers, run up and down these fibers, and help maintain them. Remember, these fibers are dynamic living units, even though they're extracellular, and are remodeled, resynthesized, sort of broken down somewhat, and so they are in a dynamic state of, or a state of dynamic equilibrium. Occasionally you can see a nucleus of a fibroblast or another cell, and you can make out the fiber actually coursing across its nucleoplasm as it's sort of on top of the cell, and you have looking through the fiber and using the nucleoplasm as a background. Another example of that phenomenon is shown here. the majority of the cells are indeed fibroblasts. Here we can see some actually sitting on collagen fiber, though the cytoplasmic extent cannot be made out, and the collagen fiber is coursing across the field. Occasionally one sees breaks in the elastic fibers. When this occurs, they'll snarl up, much like an elastic band or a fiber in an elastic stocking or sock, and will give you these little whorls. Here's another one that of larger diameter that's been broken and then recoiled upon itself. One other additional feature in this areolar preparation is shown, and one of the advantages of it, it's one of the few preparations when one can see the extent of fibroblasts. These are the fibroblast nuclei, and fibroblasts are spindle-like shaped cells, and one can make out the cytoplasmic extent going here, about to here in this preparation. In this particular fibroblast, it extends to maybe to here. The other part of the spindle of the cytoplasm goes to about this location. This one goes to about here, and this other one. Remember, it is this cell type that is laying down and maintaining the fibrous component of general connective tissue as well as the ground substance. Having once appreciated sort of the overall nature of these fibers, examine their appearance in sectioned material. This is a section of thin skin. The place to identify and examine the connective tissue fibers is that area immediately beneath the epidermis or the keratinized stratified squamous lining or covering the skin, which is shown at the arrow. So this area, as indicated by the pointer and beyond the arrow and within the field, is an example of connective tissue. In this case, the dermis, which is an example of dense, irregular type of connective tissue, one can examine the collagen fibers in detail. All of these large structures are collagen fibers, a protein that is staining this orange-pink color. Note that some are cut sort of along the long end length of their axes. Others are cut crossways, coming out at you in the field of view. So these collagen fibers are randomly arranged and form an intricate interwoven pattern. So it has to be a dense, irregular type of connective tissue. The same dense, irregular type of connective tissue seen at increased magnification. These are the collagen fibers, cut both along their long axis, at least for a small extent, and then coming out at you, they are cut in cross-section to give you these transverse profiles. Amongst the connective tissue fibers that dominate the field, one can make out small profiles of nuclei compressed within the background. These are fibroblast nuclei, which once again maintain these fibers in this particular area. The space between fibers is not normally present. This is enlarged due to the fact that this is processed tissue. Normally a ground substance would be present within this space, which does not exist in life, and there's perhaps some shrinkage and separation due to the preparation of the tissue. So both of those factors cause a separation of these fibers. But in life, there would be no space there, and if there was an area between collagen fibers, it would be filled with that gelatinous ground substance. This is an example of dense, regular connective tissue. In this case, the tissue is a tendon but ligaments, aponeuroses would look very similar, in which the collagen fibers, as indicated, and bundles, as indicated by the pointer, lie parallel one to one another. So they are precisely lined up, hence its name, dense, regular connective tissue. Collagen fiber would extend from here to here, as indicated by the arrow. These dark structures between fibers are the nuclei of fibroblasts that line up and maintain this very intense, dense structure. If we look at this particular fiber, you can see the nuclei of the fibroblast lining up and sort of separating or isolating individual collagen fibers and bundles. Once again, an example of dense, regular type of connective tissue. This particular figure is a transmission electron micrograph of type 1 collagen. It consists of several closely compacted fibers. One is shown here, one here, one here, one here, and several others forming this intricate pattern that sort of forms a background. Note that each collagen fiber is made up of a series of unit fibrils that exhibit this banded appearance when cut in longitudinal section. In other fibers, the plane of section is transversely cut crossways, and one can make out these small dot-like structures are the cross sections of these same unit fibrils. So this is a fairly decent example of a bundle of collagen fibers tightly woven together, and each one of these made up of the banded unit fibrils as indicated by the arrow. This is an example of a tissue that has been stained to show both collagen fibers and elastic fibers. Collagen fibers appear very lightly and fill in this sort of light background of material, whereas the elastic fibers stain intensely. Here's one cut lengthwise, and then some are cut in transverse section as they course out of the field directly toward the viewer. All tissues will show the mixture of fibers, but one must remember that the elastic fibers, unlike collagen, must be stained specifically to be demonstrated. Once again, the elastic fibers with collagen forming the background seen at increased magnification. The dark staining fibers are the elastic fibers. Some will be cut transversely, some will be cut lengthwise. You can see here are several that are cut in cross section or transversely coming directly at the viewer. Some are cut at more oblique angles but coming out towards the viewer, and some are cut more or less along their long axis so they can be traced a little bit further. Almost all connective tissues will show these elastic fibers, but let me caution the viewers once again, they must be stained selectively to be demonstrated. This is a section through the aorta to demonstrate another form of elastic tissue referred to as the elastic laminae. Elastic laminae have been stained specifically and are indicated at the tip of the pointer. There are probably 50 to 60 of these large elastic laminae that lie in the smooth muscle wall of the aorta and course or positioned around the circumference of the lumen of the vessel, which is located here. So these large structures that have been stained specifically and have oftentimes show this sort of meandering or scalloped appearance are the elastic laminae. This is the appearance of these elastic laminae at increased magnification, positioned between bundles of smooth muscle which are located at the tip of the pointer and will be considered at a later time. Primary purpose of this exercise is to identify and be able to recognize the elastic laminae within the arterial wall. This is a section through a muscular or distributing type of artery, again stained with an elastin stain, to demonstrate the very large elastic laminae that forms along the luminal border of this particular vessel, called the internal elastic lamina, a very, very large scalloped appearing structure, to give you a better idea of what these large elastic laminae look like and how well they can become developed. Additional elastic laminae are seen around in the field, separated once again by bands of smooth muscle. If one courses through the field, one will eventually encounter collagen, finer elastic fibers, and then finally get off to the edge of the section and witness fat cells. This is an example of an unstained or routine preparation of a vessel similar to the one shown in the previous viewing. So this is a medium-sized or muscular distributing type of artery, but stained with hematoxylin and eosin only. One can see in this preparation the endothelial lining, a large scalloped membrane, which in this particular case takes up an orange color, but because of its uniform appearance and diameter and the position is known, this is the appearance in a non-specifically stained preparation of that internal elastic membrane, one of the large elastic lamina. If one courses into the wall of this particular vessel, sort of light squiggly lines can be observed, which have a slightly different refractive index than the surrounding tissue. These are the elastic laminae and fibers within this muscle wall. Others are shown here, and the surrounding fibers in the background and forming part of this wall are collagen fibers. So indeed, elastic fibers can be seen, but they are best observed and stained specifically with some form of an elastin type of stain. This is a section of lymph node that has been stained specifically to demonstrate the reticular fiber, a very small supporting fiber that's involved in the framework, the supporting framework of most organs, particularly lymphatic organs, such as the spleen and lymph node. It's also a major component of the stroma of the liver and kidney and other organs as well. So this is the appearance one gets of the reticular fiber, a type 3 form of collagen that needs to be stained specifically to be demonstrated. When viewed at slightly increased magnification, the reticular fiber can be seen as a small, light fiber of very delicate diameter that forms the supporting framework of cells. In this particular case, the lymph node, you can see the reticular fibers forming a sort of an anastomosing network to suspend and hold and give some structural support to the cellular component within the interior of this particular structure. Each one of these large empty spaces at this particular magnification represents a single fat cell. The lipid droplet which has been dissolved away due to processing. And because they've been stained with these reticular or silver type stains or reactions, most of the cytoplasmic rim is very difficult to visualize, and the cytological details are missing. And what remains is this very, very fine fibrous network, these reticular fibers that envelop and surround each one of these individual fat cells. So these are the reticular fibers that form a major component of the stroma of most cellular and epithelial type organs, the reticular fiber. Several of those fat cells seen at a decrease in the magnification and that are outlined so crisply by that network of reticular fibers that envelops them. Learning objectives for connective tissue cells. Be able to distinguish and identify the following cell types, both indigenous and transient cells found within the connective tissues: fibroblasts, macrophages, plasma cells, fat cells, mast cells, eosinophils, neutrophils, and lymphocytes. The illustration on the screen is a high-powered view of typical white fat cells. A single white fat cell is shown here, with its nucleus being located at this particular position as shown by the arrow. An adjacent fat cell nucleus is shown at this particular location, or the cell which is located here. Once again, remember that the large unilocular fat droplet has been dissolved away due to tissue preparation. So this thin cytoplasmic rim is the cytoplasm of the fat cell that's been compressed to the circumference of the exterior. This particular fat cell seems to be quite active and involved in the synthesis of materials that it's going to store in this large central lipid droplet. For size comparison, as this is at a fairly high magnification, adjacent fibroblast nuclei can also be visualized in the delicate surrounding connective tissue. Two adjacent fat cell nuclei, one for this particular cell, one for this cell located at this position, also are shown in this field. Now, when one examines paraffin sections, this is a plastic section, so the cytological details can be made out in much greater detail. The nuclei will become quite intense and look like little dark slivers in this cytoplasmic boundary. A hint of what would be seen in a typical paraffin section is shown by this nucleus, which seems to be has shut down a little bit and has entered a quiescent or an inactive state. But all these large open spaces giving you a honeycombed appearance, overall appearance, is what typical unilocular or white fat appears like. This particular field represents a frozen section of fat that's been stained with Sudan black to illustrate that fat material, the lipid, within the fat cells, which in life fills those previously examined cells. So this is what it would typically look like in life if the fatty material was indeed stained. Those empty honeycombed appearing cells are actually filled with lipid, which is demonstrated in this particular preparation and stains black. This section represents a section from a lymph node. Examine a lymph node for lymphocytes, macrophages and plasma cells, which are in abundance in this particular organ. Examine this region as indicated by the pointer. Out near the edge of the lymph node, the outer circumference is located and indicated by the arrow. This darker staining surrounding area is referred to as the cortex of the lymph node. Examine it, picking an area as indicated by the pointer at increased magnification for the lymphocytes. Having done so, move to the interior of the lymph node, a lighter staining area known as the medulla, and examine what are referred to as medullary cords. These dark staining regions here that are anastomose and course through the field in a very irregular fashion are the medullary cords. Surrounding them are spaces called medullary sinuses. The medullary cords will be filled with plasma cells, although lymphocytes will also be present. And in these spaces, these sinuses that surround the medullary cords, is an abundance of macrophages that will contain phagocytized debris, making their identification easier. So examine this region also at increased magnification for this particular cell type, or those particular cell types. So begin your investigation or examination by examining a cortical field for lymphocytes. This is a region of cortex from a lymph node illustrating lymphocytes. The vast majority of the cells in the field, such as indicated by the pointer, are lymphocytes. Pay particular attention to the nuclear profile. A lot of dark heterochromatin closely clumped together, making very, very dark rounded profiles. The cytoplasmic extent is very, very small and can be very not easily visualized on these particular preparations. But the vast majority of these cells, as indicated by the pointer, are all lymphocytes, as there are these at the top of the field and as we trace the pointer. Indeed, there are a few cells within the field that are not lymphocytes, but by far the vast majority of those, as indicated by the pointer, are typical lymphocytes seen in a paraffin preparation. The arrow indicates one of these small lymphocytes that have undergone division. So this represents a mitotic figure in this particular field. This is a region of medulla taken from a lymph node, looking at the edge of some medullary cords. The arrow indicates the region of a medullary cord. Notice the abundance of plasma cells. This is a plasma cell, a plasma cell, a plasma cell, a plasma cell located here. They are characterized by an eccentric nucleus, a large amount of gray cytoplasm, and oftentimes exhibit sort of a pear-shaped. Oftentimes, if one looks carefully, a light clear vacuole can be observed immediately adjacent to the nucleus. This is what is referred to as the negative Golgi complex. The Golgi complex as seen at the light microscopic level. If one goes back and looks very close or near the nucleus on all of these plasma cells, one can make out that little crescent-shaped area known as the negative Golgi. So the vast majority of cells in this particular field are indeed plasma cells. If one now goes a little bit further away from the actual cord and into the medullary sinus, one will find cells such as this. Very large cells, oftentimes will show an indented nucleus, a considerable amount of cytoplasm with small granules of phagocytized debris that it's taking in, This is indeed a macrophage, located within these sinuses and functioning to take up particulate matter that flows through this particular area. The cell immediately adjacent to it, a small dark cell with just a tiny rim of cytoplasm, is a typical lymphocyte that has come into this area. Another lymphocyte is shown here, another here, another here. Eventually these cells enter the medullary cords and become plasma cells. One should remember that the plasma cell is a fully differentiated B form of the lymphocyte family. So as one moves the field, several examples of these cell types should be found: lymphocytes, plasma cells, and macrophages with their phagocytized debris. The medulla of a lymph node around these medullary cords and in the medullary sinus area is an excellent place to look and compare these cell types. That is, plasma cells, macrophages, and then occasional small lymphocytes. This is a section of thymus, juvenile thymus. The thymus is an excellent place to go and compare lymphocytes in a plastic preparation, which this is an example of, as well as eosinophils and mast cells. Examine the cortical region, this darker staining region of the thymus, and indicated by the arrow, for small lymphocytes, as seen in a plastic section. Having done so, examine this light staining area within the interior of this particular gland or organ, referred to as the medulla, for eosinophils and mast cells, and compare these two red granulated cells. This is an example of the thymus seen at increased magnification, the cortical area. Each one of these small nucleated cells, as seen with a high-powered objective, is an example of a typical small lymphocyte, closely packed together, and the cytoplasmic profiles virtually invisible. So we're relying primarily upon the nuclear profile for its identification. These would be all T lymphocytes as they are developing within the cortex of the thymus. This is what typical small lymphocytes appear as in a plastic type of section. Once again, a mitotic figure of one of these cells in division. Occasionally, large light staining cells can be observed. One is shown at the pointer, its nuclear profile, and its cytoplasmic extent is being traced by the pointer. These are macrophages that do come into this area and will phagocytize small lymphocytes and destroy them. This is an example of this process going on here. You can see there's a lymphocyte at this particular location, another very pycnotic one that's been taken up by this macrophage and are going to be destroyed by it. This is a region of the medulla from the thymus, comparing profiles of eosinophils and mast cells. These small cells, as indicated by the pointer, with the bright red granules and two nuclear profiles, are typical eosinophils as seen in a plastic section. Likewise, there's another profile as indicated by the pointer. The first point of identification is the bright red granules, and confirmation to cell type, look at the nuclear profile. It is a bilobed or a trilobed nucleus. Remember, the eosinophil is a polymorphonuclear leukocytes, one of the white blood cell line, and we'll show this lobulated nucleus. It's one of the lobulated leukocyte forms, but it's characterized by red granules. Now, confusing the issue somewhat, on these plastic sections are large cells, as indicated by the pointer, or perhaps this one with a much lighter nuclear profile, that also show red granules. These are mast cells, resting granules, or resting cells that are sort of rounded up in this particular area, and can be compared with the eosinophil. Another mast cell shown here, and then an eosinophil crawling through this region as indicated by the pointer. This is perhaps a little bit better mast cell, showing you it's a much larger cell in comparison to the eosinophil. And its key feature, in addition to the granules which immediately attract your eye, it has a single nucleus. The profile may be round and spherical, as indicated in this particular field, or it may be elongated when it exhibits amoeboid movement and is actively crawling through a field. So let's look at this field once again and compare the cell types, the mast cell and the eosinophil. A mast cell, a very large cell located here with the red granules in the cytoplasm, a single nucleus. A typical eosinophil, quite a bit smaller, exhibiting two nuclear profiles, or if you happen to get it cut along its entire length, you can see that it is indeed a polymorphonuclear leukocyte. Another example of a eosinophil is shown here. Another mast cell is shown at this particular location. An additional field of eosinophils and mast cells seen at slightly less magnification. Just to point out these cell types, because it is a point of confusion. Mast cell, eosinophil. Mast cell, eosinophil, eosinophil. Eosinophil, eosinophil, mast cell, mast cell. So what I'm using is the nuclear profile as well as the overall size of the cells. And here's an eosinophil, an eosinophil, an eosinophil, and then a much larger and well-defined mast cell. This is an excellent place, that is the juvenile thymus, in which to compare these particular cell types. Examine the stomach wall for examples of migrating mast cells or moving mast cells that crawl around and function in this particular area. So these are active mast cells that are exhibiting amoeboid movement and are crawling around in this particular area. This is the area one should look in, the submucosal area and the sort of the adjacent area of smooth muscle, which is located here as indicated by the pointer. If one courses through the section of the stomach, this is where the gastric glands are. The surface epithelium lies as indicated by the pointer, and the pointer now resides within the gastric lumen. To examine this section for these particular cells, you want to go to the interior and look in this region of the connective tissue, which is referred to as the submucosa, for mast cells crawling through this particular area. The cell at the tip of the pointer is a typical mast cell as viewed in a section of material coming through the gastric wall or the stomach wall in the submucosa. So this is the external extent. If one carefully looks to into the interior of the cell, one can visualize individual mast cell granules. And note also this clumped nature to the nucleus, a characteristic of these crawling cells. If one courses around and looks in the background, this is a nuclear profile of a fibroblast. And these light staining regions here are examples of collagen fibers as demonstrated in these plastic sections. Again, an adjacent field showing you 1, 2, 3, 4, 5 fibroblasts. And the intervening fibrous material is all collagen, as seen in this particular type of a preparation. Another section, more of a lengthwise cut through a mast cell with adjacent fibroblast within the background. A very narrow section through just a grazing section through another of the mast cells. And once again, a field of fibroblasts and their associated collagen fibers. An example of two adjacent mast cells as they crawl through the tissue and exhibit sort of an amoeboid movement. The cell is located from here to here, so it's been cut through the long longitudinal axis. Its nuclear profile located here. It's another mast cell. It has an eccentric nucleus. This cell is perhaps crawling out towards us and has been sectioned obliquely, so we're actually only visualizing a portion of the cell. So these are the mast cells as they are actively crawling through the tissues in a region known as the submucosa of the stomach. An additional mast cell is shown crawling into the field at this particular location. Examine a section of small intestine for yet another example of these immunocompetent types of cells. The intestinal lumen is located in this particular area, with intestinal villi as indicated by the pointer, and the simple tubular intestinal glands that were examined earlier also shown in the field. The place to examine for the immunocompetent cells is in that connective tissue surrounding those simple tubular glands, and as indicated by the pointer. These particular interstices are lined by, or filled by, I should say, plasma cells, eosinophils, plasma cells, and macrophages. So examine these regions lying between the simple tubular intestinal glands for these immunocompetent cells. They form a system known as the gut-associated lymphatic tissue, and gives you yet another example to compare and contrast these cell types. The space between the intestinal glands, as seen at increased magnification. This profile is indicated by the area is that simple columnar epithelium lining one of those simple tubular intestinal glands. Another is shown here, another is shown as indicated by the arrow. Note that filling in between these glands, in addition to general connective tissue, that is fibroblasts, some very fine collagen fibers, you can find immunocompetent cells. This area or field here represents a collection of 1, 2, 3, 4, 5 plasma cells. Looking a little bit different, but they have that clock face or clump nucleoplasm, and you can see a considerable amount of a cytoplasm associated with them. Also found in the field will be lymphocytes. Various types of blast-type cells, that is, dividing cells within the lymphocyte line, and occasionally eosinophils and macrophages will also be observed in these regions. So examine several of these areas just to get another view, another feel for these particular cells. I moved the field slightly between another region between intestinal glands to show you more plasma cells, some dividing lymphoid types of cells, and in this particular field, 2 eosinophils as well. An excellent place to look at the various immunocompetent cells in action is the site of some infection. This particular section is a section to the eyelid that exhibits a chronic infection. The epithelial lining along the conjunctival area, a stratified squamous type of epithelium that has mucin-secreting cells within it, is located here. An area of chronic infection lies below it, and even at this very low magnification, one can see sort of a lymphocytic infiltration. With the invasion of lymphocytes, the various leukocytes, one obviously is going to see a differentiation into plasma cells. So all of these cells, the mononuclear leukocytes, that is lymphocytes, monocytes, into macrophages, plasma cells, as well as the polymorphonuclear leukocytes, should be found in this particular area. Let's begin by examining the surface epithelium at increased magnification and just course through this tissue, seeing if we can identify the various cell types. Beginning with the surface epithelium, which is highly disrupted and shown at the pointer, note a very interesting phenomenon during this dramatic process of infection. The epithelium is somewhat disrupted and is difficult to visualize, but a stratified squamous type of epithelium extends where the arrow begins and then up to where it ends. What makes it confusing is if we begin examining this blood vessel, a small capillary is shown here. Here are the endothelial cells, their nuclei that is, red cells coursing through the lumen, and escaping and crawling away from this blood vessel are leukocytes. In this particular case, they are neutrophils, polymorphonuclear leukocytes, and the cytoplasmic details cannot be made out, but this lobulated nuclear profile can be made out. It's what should be looked for in examining these cells crawling within a tissue. Note that they have migrated through the epithelium, pushing the various cell types making up the stratified squamous epithelium apart and squeezing between them. Here we can see a profile of another polymorph coursing here, another poly is located here, another here. So each one of these lobulated structures represents a neutrophil crawling through this epithelium and extending all the way to the surface and making the crisp identification of the epithelium a little more difficult. If we move the field over just slightly, you can see accompanying these leukocytes are some red granulated cells, and so this would be an example of an eosinophil. Another is shown at this particular location. So this particular patient, let's say if you were examining it him or her in the clinic, it would present an eyelid that is pussy. If you pulled it down and looked along its interior surface, it would be white and matted and covered with pus. And please do recall that the neutrophils are a major component of this substance referred to as pus. As we course down within the field a little bit further, one can see it is absolutely packed with lymphocytes, some of which show an accumulation of cytoplasm indicative of their transitioning or becoming perhaps plasma cells. A couple of granulated red cells can be seen in the background, indicating that these are perhaps eosinophils. Now, coursing across the field and through the field, one will see a variety of different cell types. Here's a pretty crisp looking eosinophil with its bilobe nucleus and bright red granules. Cells such as this are fibroblast type nuclei forming the background. And within the other cell types that we've already identified, that is the neutrophil, eosinophil, and lymphocyte, we should eventually, as the field is moved around, chance upon some plasma cells. This represents a slightly different region, moved a little bit more peripherally from the lymphocytic infiltration, showing once again an eosinophil and a plasma cell located here. Its eccentric nucleus and small negative Golgi, and differentiating lymphocytes in the background. Indeed, another field of plasma cells. More plasma cells. Another region of this site of chronic infection, as seen in an intermediate power, is a large accumulation of cells, as indicated by the pointer. These are known as foreign body giant cells and represent the fusion of several macrophages into these large giant cells, sometimes characteristic of certain chronic infection. So this is representative, this large mass of nuclei and cytoplasm is representative of one foreign body giant cell. Another is shown here, another is shown here, and another one is localized here. An example of one of these foreign body giant cells as seen with the intermediate objective. Another is shown here, and another here. In other adjacent regions of this particular preparation, cells can be found that take up a fine gold-brown pigment known as hemosiderin, and their processes can sometimes be made out as they follow a long spidery course. These are macrophages within the dermis underlying the skin that have picked up this hemosiderin pigment. The nucleus of this particular cell is located at the tip of the pointer, and if one carefully observes its cytoplasmic processes can be seen going in a variety of directions. Another cell is located here, and its cytoplasmic granules or processes have gone out this direction, a very thin spidery appearing cell, and you can see the outlines of its cytoplasm because of the hemosiderin pigment that it has phagocytized. An example of another one of these cells is shown at the tip of the pointer. Another one is shown here. So these are macrophages crawling within tissue, so they're not rounded up as you saw in the lymph node. This is where they're dynamically crawling through the tissue and phagocytizing the hemosiderin pigment. A number of these examples should be encountered in this particular preparation. An additional example of a macrophage crawling within tissue that's filled with hemosiderin pigment. The nuclear profile is located here, and the extent of its cytoplasm is being traced by the arrow. So this is another example of a macrophage histiocyte within tissue.